Let's discuss easy fabrication of bisacrylate provisional restorations for full crowns on posterior teeth. Prior to the appointment, the assistant fabricates a matrix from polyvinyl siloxane. She lubricates the model with Vaseline prior to placement of the body polyvinyl siloxane. For full crowns, this is fabricated on a study model or a waxed up model. She then wets the model and squirts washed polyvinyl siloxane into the previously made polyvinyl siloxane body matrix and places that on the lubricated study model. Allows it to set for about 5 or 10 minutes and then trims the excess. Bisacrylate is squirted into the matrix. Now it's very important that you keep the tip of the bisacrylate in the material. If you take the tip out of the bisacrylate material, you'll create an air bubble. Then you wet the prepared teeth and squirt the bisacrylate around the teeth, and do this quickly. If there are any composites on the teeth, as in this case there's a occlusal composite on the second molar, be sure you place Vaseline on the composite or the bisacrylate will stick to the composite. Then place the matrix into which you've already squirted bisacrylate. Now all this is done within about 15-30 seconds, and you can see these are deadly accurate margins. The thing that makes this so accurate is it's just like the custom tray with polyether impression. This matrix forces that unset bisacrylate up into the sulcus and captures that tooth preparation margin very crisply and very accurately. Now I'm wiping the teeth with Tublicid Red, cord placement, then impression taking with polyether with custom tray, taking occlusal registration record, now marking the interproximal contact of the bisacrylate provisionals, and then trimming them with an acrylic burr. It's very easy to see the margins with this technique. The thing you'll really like about the bisacrylate provisionals versus conventional acrylic provisionals is the bisacrylate doesn't heat and it doesn't shrink. Then just very slight internal adjustment, just remove any sharp angles or anything that might prevent the provisionals from seating. Wonderful fit. If you need to add any bisacrylate to some small void, you can do that with flowable composite. Now I'm going to cure the added flowable composite for 20 seconds. Check the occlusion. Adjust the occlusion with an occlusal reduction burr. Polish. And I'm just refining the added flowable composite. There might be any sensitivity. You can use Super Seal, or just a good cleaner is Tublicid Red. Tublicid Red is a good cleaner desensitizer. I'm going to place Vaseline all over the provisionals. I don't care if some of the Vaseline gets into the inner part of the provisional. Then place your temporary cement and just place that around the edges. Don't fill the preparations up. I'm going to let the teeth be damp. I don't particularly want them to be completely dry. Push to place. Wait till the provisional cement has initial set so it peels off. That way you don't have a void in the microgap between the tooth and the provisional. If you remove the provisional cement in the unset phase, you'll have a little suck back in that microgap and you might have sensitivity. So I'm using the back end of a scaler, then flossing, and then this is just a wet cotton ball. Fast, easy, and accurate bisacrylate provisionals.
Thanks so much for tuning in to the Dental Minute with Dr. Stephen T. Cutbirth. Go ahead and press that subscribe button because next week we'll be telling you how to prep a full arch of crowns.